Hi everyone, this is Kurt Ashley Amroas and I'm here to demonstrate on how to manage healthcare information in an electronic medical record using the nursing process. Before we jump to the EMR, I'll be showing you the workflow designed to support the use of an electronic medical record in healthcare management. The flow will serve as our guide in doing our work and process in the EMR. We will be utilizing OpenMRS as our electronic medical record. Launch the site and log into the account. Select Inpatient for our purpose of this demonstration. Then register a patient by clicking on it. The client verbalized that his name is Judiel M. Mojica, a male with a birth date of July 12, 2000, residing on 181R 25th Avenue, East Rembo, Makati City, Philippines, with a postal code of 1216. He stated his phone number and his relative, which is the parent. After inputting all the data, we check the information then click Confirm. By clicking Confirm, this creates the medical record of the client. And to demonstrate the searchability of the client, we can go to the Home button, then click Find Patient Record, search the name of the client, and it will appear on the search result if registered. Next step is click Start Visit to record the status of the patient today. Click Admit to Inpatient, then select the date of admission, who admitted the client, and what ward or service, which in this purpose is inpatient ward, then click Save. After that, let's capture the client's vitals. The vital taken as follows. After inputting all the data needed, recheck and save. After getting the vitals, click Visit Note. In Visit Note, we will be doing our nursing care plan for the client. In the case of the client, Mr. Mojica verbalized, medyo sumasakit siyan ko nurse at napapadalas yung pagdumi ko ngayong araw. As I further assess the client, I've observed abdominal pain, frequency of stools, and loose or liquid stools as answered by the client to the interview. Bloated abdomen and vital signs taken as follows. The presumed diagnosis is bacterial diarrhea or bacterial gastroenteritis. The nursing diagnosis is diarrhea related to malabsorption as manifested by the following. For the planning, after 7 hours of nursing intervention, the client will be able to report reduction of frequency of stools. The following listed are the nursing diagnoses that will provide care and help to the client. For the evaluation, the goal was met after 7 hours of nursing intervention. The client reported reduction of frequency of stools. For imparting health education to the client, the first one is if the client experienced cramping, avoid food that may produce gas such as carbonated drinks, beer, beans, cabbage, broccoli, and so on. Diarrhea can lead to dehydration associated with loss of minerals, so it is encouraging to increase fluid intake to replenish lost fluids and minerals. Other health education is encoded as follows. After inputting all the needed information in the clinical note and the diagnosis of the client, recheck and hit save. In creating my nursing care plan, and searching following terms and information, we need to evaluate the validity, reliability, and the appropriateness of the information that we gathered in the internet. In my case, I use Merriam-Webster as my dictionary in defining medical terms such as malabsorption. And I chose Nurse Labs as my reference in formulating or creating my nursing care plan for diarrhea. It provides specific information that is relevant in enhancing the health of the client and his situation, and the site is valid and reliable for having citation, author, and date of the information was published. After doing the visit note, we can fill in relevant information of the patient dashboard, such as the allergies of the patient. Click Add New Allergy if there is any known allergy present to the client. Mr. Mojica stated that he has allergies to dust and his reaction to it is itching and shows a severity of mild symptoms. So for the comment, itching is usually relieved by sugar intake. Maintaining cleanliness to the surrounding can prevent dust allergic reaction. Then verify all the information filled up and click Save. Here are the health education sample rubrics. For accessing health information, I give the score of 4 because I've located the very specific sources of health information and services which is relevant for enhancing health of the client of mine who is having a diarrhea. I also give a score of 4 under evaluating information sources because I've explained that the given sites that I've used, which is the Merriam-Webster and Nurse Labs, is valid, reliable, and appropriate as a result of the evaluation of the sources. The sources have authors, date of the information published, and citations to justify the information. In source identification and source validity, I give a score of 4 because I've identified all my sources of health information and I clearly state what site I found my information and give a thorough explanation to all of my sources on how I utilize it to the given health situation. That's it! To summarize it up, the client is Mr. Judiel M. Mojica, diagnosed with bacterial gastroenteritis. Vital signs taken as follows. Height is 163 cm, weight is 65 kg, the BMI is 24.5 which falls normal, his temperature is 36.8 degrees Celsius. Pulse rate is 88 beats per minute and respiratory rate is 15 breaths per minute. Blood pressure is 120/80 and arterial blood oxygen saturation is 97%. Diarrhea was diagnosed to the client due to the assessment findings such as bloated abdomen, loose or liquid stools, urgency to defecate, and abdominal pain. The current weight graph is 65 and the recent visit is 25th of May 2021. There is no other conditions present to the client, and for the allergies, the client is allergic to dust with mild severity of itching. After all the necessary interventions done, click and visit, and once again we can check the searchability of the client if we go to the home button and click find patient record and search the name of the client. After we verified and finished, we can log out now to protect the data of the patient and promotes privacy and confidentiality to the information of the client.